Hello, it's Dr. Rhonda Johnson, and today is Monday, August 31st, 2020. And today I'm going to be talking about children and COVID-19 and the new White House pandemic advisor, Dr. Scott Atlas, and the politics of misinformation. But first, let's talk about children. There was a recent paper published in a Journal of American Medical Association Pediatrics that looked at a study from South Korea that talked about children and the COVID-19 infection. And I'll just highlight some of the positive findings of that study. Well, children with COVID-19 can shed the virus for up to 3 weeks, even when they're asymptomatic, according to this study. And half of the children that were studied continued to shed the virus for 3 weeks. The authors concluded that a considerable number of children are asymptomatic, and even if symptoms are present, they often go unrecognized and overlooked before COVID-19 is diagnosed. According to these experts, COVID-19 cases tend to be less severe in children than adults, and the role that children play in this transmission is not yet clear. But what they do know is that children, younger children in particular, have been found to carry greater amounts of the SARS-CoV-2 virus in their noses than adults. And the study also reached a number of different conclusions. That the most common symptoms of children that were in this study were fever, respiratory symptoms, and gastrointestinal symptoms, followed by a loss of smell and taste. Children with coronavirus in this study were symptomatic for, on average, 13 days, but some kids had symptoms for 5 weeks. They also said that with kids going back to school, if they get infected and bring it back to their homes, it's going to likely increase the cases. And just because kids come back from school feeling great doesn't mean that they aren't going to spread the virus. The authors estimate that 93% of children in this study would have been missed if only symptomatic cases were tested. And this suggests, again, the strategy for children needs to be widespread testing, including testing of asymptomatic children, which sort of goes against the recent change in the CDC guidelines around testing. So I'm going to move on and talk about the new Trump pandemic advisor. So if you haven't seen Dr. Fauci much lately, we know he had surgery on his vocal cords. We haven't seen Dr. Deborah Birx, but we have seen a new doctor, Dr. Scott Atlas. And unlike Dr. Deborah Birx and Dr. Fauci, Dr. Scott Atlas, the new pandemic advisor, he has no infectious disease training and no public health experience. He's a former neuroradiologist and he's currently a senior fellow at Stanford's University Conservative Hoover Institution. He is a staunch proponent of reopening the economy and sending children back to school for in-person classes. And he doesn't even believe that there's enough scientific evidence to recommend mask wearing. He has stated publicly that he's unsure scientifically whether mask wearing makes sense. He's also a big proponent of herd immunity. He talks to the president every day, supposedly, and what he believes is that we should allow the coronavirus to spread naturally through the population, and by doing so, healthy people will build up resistance to the virus. He believes we should take steps to protect people in nursing homes and those who are vulnerable. But this is in direct contrast from what Dr. Fauci has recommended. Dr. Fauci went on record as recent as August 8th, speaking against this herd immunity approach, saying that if the United States allowed the coronavirus to spread unchecked in an attempt to try to achieve so-called herd immunity, the death toll would be enormous. Now, continuing on with misinformation campaigns. We've seen the CDC try to change the recommendations around testing. And now the CDC has drastically adjusted the number of deaths downward. And over this weekend, President Trump has tweeted these coronavirus death statistic conspiracy theories. And this has also been on the favorite news channel of the White House, Fox News. And they are reporting that the death toll is actually about 1/20th of what is being reported. Now, this is just unbelievable. And both Dr. Fauci and Dr. Birx have warned against conspiracy theories about coronavirus death data. Now, if anything, they believe that the death toll is underreported. They believe that it's significantly higher than the 180,000 plus figure that we have been told. And public health experts believe that it's already crested above 200,000 weeks ago. Now, we know that this death toll is just tragic. Our coronavirus pandemic death toll is greater than the number of people who died in Nagasaki from the atomic bomb. It's greater than the number of people who died in Hiroshima from the atomic bomb. It's greater than the number of people who died on the battlefield in terms of American soldiers in the Vietnam War, the Korean War, and many wars. And I'm going to provide reference to that. And this is data from the government. So again, we have to question, why is there this deliberate attempt to change the statistics? Well, of course, because it's an election. So again, I've repeatedly said, be careful what information that you're listening to. This is unprecedented to see this level of interference with healthcare and the public health. And I'm very distraught about this. I'm very saddened to see this happen. But I'm sharing this information so that you can be informed. So stay informed. Stay well. Don't let anybody try to convince you that the coronavirus is not a threat to your very life and your health and the people that you care about. This pandemic is real. It continues. So stay the course. Continue your 3 W's. Wash your hands, wear your mask, and watch your distance. This is Dr. Rhonda Johnson. These views are my own. I know they're a little bit political, but management of this pandemic is political. And we have to see what's going on. So, have a blessed day.